Hi, this is Dr. Pruner with Foot and Ankle Associates of North Texas. Today I'm going to show you how to apply your walking boot and also how to walk in your walking boot. So the first boot we're going to talk about today is the short boot. This boot in particular is for foot issues that don't involve tendons that start in the top of the leg, and the application is pretty straightforward. So all you do is you take your foot and you slide it inside. You're going to feel that there is a back part here where the boot does not touch. This is to give you space for your heel to protect you from the back. So you place your foot securely strap the front, securely strap the top, and if you need, there's pads here for you to place on your ankle if the straps are irritating. Also, you can place them underneath your toe if that spot becomes uncomfortable for you. That's a little trick. The important part of this boot is to make sure that the top strap is secure, but the bottom strap is the most secure. So you take this and you pull relatively tightly. The next one you apply is to keep your foot from going forward. And this last one is the one that you want the most secure, but not too tight to where it's uncomfortable. This belly here is to pump air into the cast if it ever feels like it's loosening from continued use, or also if you have any swelling to help with compression. You pump it up until you feel the bellies fill to comfort. Don't let your toes go numb or tingly. And once that's done, if you need to release any, this valve here is what you apply and you'll feel the air escape. So the first thing that I'm going to show you to apply this even up appropriately is to take your shoe off and not do it directly on your foot for safety reasons. We'll fit you in the office for the right size, but the first thing that you do is you take the strap and you pretty much can either lift it off or just lift it up a lot. You're then going to slide your shoe in, okay? This little back piece goes towards the back and you just secure the rubber around rubber, okay? Then you take the front of your shoe and do the exact same thing. There we go. And that way it's nice and secure on top. But then you take your strap that you just had and you're going to secure that to your shoe. It's not about being tight because you want your foot to be able to fit in it, and you can adjust that as needed for where your foot is going to fit in the shoe. All right, so now that we have our even up in place and our boot is on, we got to make sure that it's secure now that we're standing because the tightness will adjust. So if this top strap feels any looser, give it a nice pull and secure it a little bit tighter, okay? So whenever you're walking, the whole concept is heel to toe. So you're going to just let the roll on the bottom of that boot glide you forward. So whenever you take a step, you're going to hit on the back of the heel and it's going to roll forward, okay? The whole concept is that you want no pressure on the spot that's giving us an issue. And so as it rolls forward, it decreases the amount of contact with the foot to the ground. So as you take a step, you're going to roll forward, and your even up is going to emulate just a taller shoe and make this much more comfortable to take a step and not feel very teetery. So the next boot that we're going to apply is the tall boot. This one is more bulky. It is more of a pain to wear, but the point of the boot is that whenever it's secure to the calf right here, it's going to immobilize those muscles that eventually turn to tendons and attach to the bottom somewhere in your foot that, in the case that the doctor has diagnosed you, is causing your issue. So in order to wear this boot, there's a little couple of differences. One, you have this little pull tab here that's going to secure the Velcro to the cloth. You hold off on those until you're nice and secure into the boot. And then also for the soft felt that's going to pad some of your prominent surfaces, it has these little holes here for you to apply to this strap across here because there's a lot of rubbing that can sometimes occur at that little transitional point at the ankle. So what you do is you take the boot and just like before, you slide it in, okay? Now this one you want to make sure you're nice and seated in the back like before. with the same rule that doesn't go all the way to the back. It's just for your heel to make contact with the cloth in the back. So once you're in the boot, you just nicely secure yourself from the top and the front. And then the rule of these straps is these just need to sit comfortably, but these straps up here need to be the tightest. It's tight, tighter, tightest, okay? So you secure this guy. The whole key as well, don't let your toes go all tingly, but you do want to at least experience some tightness to the calf to immobilize those muscles. So this one is tight. This strap is tighter. Struggle there. And this strap is the tightest. Now, if that ever feels too tight, of course you can loosen it, but once you stand, that'll determine that for you. And the same with the belly here. That's to pump air to make it feel a little bit more secure. But also, if this boot is being used for a surgical purpose, this can help prevent a blood clot. And you release this valve here for any air that you need to release. Now that it's secure, you can pull the tabs out like so. And you're good to start walking. All right, so now that we're in our tall walking boot, there's a couple of differences here compared to the short boot. Number one is that with these straps up here being tighter, you're going to feel your foot kind of lift up out of the boot. And that's going to make it to where your foot is actually floating and not making 100% contact whenever you walk. So to walk in this boot, same concept, heel to toe. It's going to roll forward, but also you're going to feel that lift. So it's important to make sure that you can compensate with that weight. So it's a nice step forward and have your foot ready in the front. So these are just a couple more additional tips for the boot. Sometimes your doctor is going to have you place an insert inside the boot. This is going to be for pretty specific reasons, like if you have a plantar fascial tear, you have a capsulitis that they need to offload on the bottom. But regardless, sometimes it can be confusing on how to apply this into the boot. So number one place to place it, because you have to, is directly on top. And there are two ways to do this, so if this feels better, if you're going to place it on the inside, you can see here how it wants to stick out. You want to place it securely in the back where your heel is supposed to sit, okay? So whenever you place it, don't let it slide too forward because it will be difficult to get the offloading that your doctor is trying to achieve. So make sure it sits nice and back in the boot. Additionally, you can place it on the bottom by lifting it up here and placing it securely on the bottom, but make sure it's sitting in the same place and you test trial on your foot to make sure that you're getting the offloading that you want from the foot. So whichever way you prefer, as long as you don't feel any prominences to the spot that your doctor is trying to treat, you can try these both ways. And sometimes a little self-adhesive Velcro you can place right here to make sure it doesn't shift too much until you're ready to transition this into your other shoe. The last thing that we're going to show you is these little special felt pads. Now these just seem like a little additive to the boot, but there's a couple of creative ways to make the life of having to walk in a boot a little easier. If you're doing what you're supposed to be doing and wearing this boot consistently, there's going to be some spots that end up rubbing in this device, and that's what these pads are for, are to help alleviate those discomforts. The first place is typically on the bottom right here as this wants to flatten out. So what you do is you just take it and you can push it right underneath the foot right there. And that way, if you have any uncomfort or discomfort, you can place it right here and that should alleviate that. Another spot tends to be in the very back of the heel, right where the transition is of the boot. So you can also take a pad and place it right back here so that you have a little bit more cushion whenever that starts to wear. Another spot sometimes can be right where the ribbing of the boot is. And so you can either lift this up and place it on the inside here, or you can secure it with, a self-adhesive Velcro right on the inside where the spots are rubbing, and that way you don't have any discomfort. And this is very patient specific, depends on how much you're walking in your boot. Sometimes if it's about a weekend and you're already destroying the boot, your doctor's going to tell you you're doing too much and the purpose of the boot is being lost. But if you have any rubbing or tender spots in the boot, these are just some suggestions to help you out. So if you have any additional questions about using a walking boot, an even up, or your insert devices, talk to your doctor or come and visit us at Foot and Ankle Associates of North Texas if you're in the DFW area. Thanks and have a great day.